Dr. Middleman?
Thank you so much. I just want to clarify, I'm very concerned because after 21 years on the committee, it has always been clear that vaccines are a primary prevention public health strategy that is remarkably different from treatment with antibiotics or treatment for patients who are seeing providers on an individual basis. This is why a lot of the policy that currently exists around vaccines exists. If we start asking for prescriptions for vaccines, which are, again, a primary prevention public health strategy, we are going to overwhelm physicians' offices. As a practicing physician, I'm sure others will agree with me. I'm not even sure what you mean by a prescription, because when patients come to the doctor, there's an order, there can be standing orders. We don't send anybody with a prescription to the pharmacy. They can get it at the pharmacy. And so I'm not even clear on what this is about, but what I can tell you is that it's alarming to me that for a primary preventive strategy, we are actually adding access concerns and barriers. The job of the committee is to assess the risk and benefit as a public health strategy. That's been done, so we should make it available and accessible. Thank you.
Thank you. We have already is way beyond the time. We should have finished quite some time ago.
Point of clarification, do we have a modified amendment or not? And if the amendment as written stands, I move that we proceed to a vote. Over.
We don't have an amendment. We also have Dr. Malonne.
Yes, thank you. The Association for Prevention, Teaching, and Research. I just want to echo what my other liaison representatives and what Dr. Blackburn has so thoroughly stated is just, and really urge the committee to really think about how this will impact access, and that if pharmacists are the ones that the majority of patients are going to obtain their COVID vaccine, and if the committee, as they voted to pass the vote in vote number 4, are allowing for that choice and individual decision making, again with vote 1 being that we have this more informed consent process, which I'm all in favor for. Maybe perhaps also our CMS representative could speak a little bit more to what this requirement of prescription would mean for limiting pharmacy ability to give this vaccine. Thank you for taking my comment.
So thank you for that. Thank you for that comment.
We have a motion for vote, right?
Can you please? I'm talking now. I can share this meeting, and that's the only way to finish is if you let me do that. Is the committee ready to vote on the motion?
I move that we vote on this motion. I second that motion.
That has already been passed. I call for a vote. We have 6 votes for no. We have 6 votes for yes. Since it's a tie, the chair breaks it. I voted no, so the motion has failed. We now have number 3. We are half an hour over time. We have 2 options now because people are going to the airport. My view of this motion is that it's, I agree with everything, just like I agree with apple pie, motherhood, and fatherhood. If we can proceed to this vote without a discussion, I think we have time to do so. If a discussion is necessary, we might have to table the vote. So first of all, I would say, is there a motion to adopt?
So moved.
Second. Thank you. It is moved and seconded to adopt the recommended language for this motion. Is there a debate?
Motion to vote seconded.
Is the committee ready to vote on the motion? There were no objections, so we proceed to vote. Please state your name and if you have conflict of interest and your vote. We're going to start with Dr. Meissner.
Yes, I've hardly had a chance to read it. Cody Meissner, no conflicts of interest, and
we can go back to you if you want.
Yes, could you come back?
Dr. Pollock?
Raymond Pollock, no conflicts, vote yes.
Dr. Pagano,
James Pagano, no conflicts, yes.
Dr. Stein,
Kathy Stein, no conflicts, vote yes.
Dr. Blackburn,
Hillary Blackburn, no conflicts, yes.
Dr. Malone,
Kirk Malone, no conflicts, yes.
Dr. Malone,
Malone, no.
Dr. Kohler, I don't know if you can hear me. I can't. Somehow I've lost the connection.
Hey, Cody, it's Amy Middleman. I think we've all have.
Thanks, Amy.
Looks like they cut the feed.
They probably lost the time. This is Phil Sartre with Bio. I did email Dr. Zadeh to say that we lost sound right when Dr. Malone was voting.
How are you going to vote, Cody?
Dr. Meissner,
Yes.
can we have your vote, please?
Thank you. I've been waiting patiently. My understanding is the healthcare provider can be a pharmacist, and as long as the pharmacist, this isn't going to place undue weight burden on the pharmacist, then I would vote yes.
Thank you. And since I have to vote last, I'm just going to repeat my vote. Martin Kulroff, conflict of interest, no conflict of interest, I vote yes. So we have 12 votes yes and 0 votes no, so the motion is carried. So I would like just to thank everybody for spirited discussions, both within the working group